So people, in this video, let us look at a very sensitive topic, how to manage a patient who is dying. So you're managing a patient who's dying. So that means you're a doctor. So in that context, we're covering this topic. So the patient is going to die. So basically what they are going to say here under death and dying topic. However, medical science has improved. You have a new liver, you can put a new heart into somebody, you can put so much. But one thing is inevitable, that is death. So you can prolong life, but you cannot prevent death, right? So some or the other time this is going to happen, and so you have to plan for it. That's all that they are saying, this textbook. So you should know the wishes of the patient, etc. How some things like that, if you know. Okay. So diagnosing dying, under this, what are they trying to say? So you should be able to recognize this. That is what they are trying to say. Will you be able to recognize that this thing is going to happen? That is what they are trying to say. They're not giving explicit details as to what those medical cutoffs, etc. are. So you may need to have a clear decision from the patient who is dying. You should probably even record that if legally you are allowed to. Especially they are saying some cancer patients who are unable to take any water also, or if they're not able to take their tablets, etc., or some things like that, you should be able to diagnose the dying. So management of dying, you should be able to give some symptomatic control, relief of distress. So you should be able to provide care for the family. Okay, you should be able to guide them what to be ready for, etc. So this textbook that I'm referring to at the moment is Davidson. So this is different country and different type of regulations there. But you should just understand how they are trying to give you a picture of how to handle death. Okay. So they are saying that you can give, for control of pain, you can give morphine or diamorphine. Okay. Then you can levomipramazine to control nausea, haloperidol to treat delirium, diazepam or midazolam to treat distress, hyoscine hydrobromide to reduce respiratory secretions. So these are some drugs that they are telling you to manage the dying. Okay. So actually for me, it sounds very nice if they can give me some painless death, right? That's what I would like. So one thing that the textbook says is that you should be in communication with the patient and the family as to what their wishes are. If there is any change in plan or the change in their decision, so all that you should know. Okay. So we'll go to the next slide here. Ethical considerations. So you should listen to the family and patient, and you should take their wishes on board. That's what they're saying. So again, in this ethical considerations, they are reiterating the same thing that we have already told you. Okay, now coming to capacity and advanced directives. Okay, so this is more about Western society. Remember that. So this advanced directive is, they're saying that is a previously recorded written document of a patient's wishes, what the patient wishes. Okay, then whenever they were capable of making this decision, they would have given this directive. You should understand that. Okay. So basically capacity, the patient should have that capacity to express their view. Okay. They should not have any cognitive impairment or etc. And then you will have taken the advanced directive. Okay. So this is what you should understand. Legal binding of different country will be different. So the last slide here is actually, this heading is euthanasia. So basically a doctor can be asked to end the patient's life. Okay, the patient or the family may ask. It's very common in veterinary science anyways. So here we are talking about humans. In some countries it is legal. But you as a doctor should understand that this is a temporary thing, that the pain that they are going through or they can recover, etc. So it is you should know your country's laws. Okay. Then how will you give the lethal drugs to enable the euthanasia, right? All that you should know. So maybe there should be some training on this, which we do not have. Do we have a specialty called euthanasia here in India? So that's all we wanted to cover in this video. Now let's summarize. So this is the summary. Patient and families awareness. Okay. So first thing you will do is patient and families awareness. Assess the patient and families awareness of the situation. They should be aware of the situation. It should not come to them as a shock. So you should prepare them. Ensure patient, if able, and family understands the plan of care. So both the patient, if possible, and the family should understand what the plan of care is. Okay. You're not going to say that the patient is going to die. You're just going to say what the situation is, right? Is the patient on NORAD, or is the patient on oxygen, or is he able to breathe by himself? I'm just giving you some high level. Okay. Medical interventions, you will stop non-essential medications that do not contribute to symptom control. So basically non-essential medications only they are saying they will stop. Something like that. Okay. Inappropriate investigations are all not required. Okay. At this moment, that's what they're saying. Whatever is required only we'll do. Basically this is kind of a whatever life saving, that's what they're saying you do. Okay, then coming to resuscitation, you will ask if they want a do not attempt cardiopulmonary resuscitation form. So do you want that? So or do you want us to do CPR, right? So basically, you know, the patient is going to die and what the situation is if you do CPR. So you'll have to explain that. You'll have to deactivate implantable defibrillator. So this again is a very this is a textbook that is telling you to do this. Okay, so but you should know when to do it and how to do it. Then symptom control. So you will just give some drugs for symptom relief. Okay, so like we told you all the drugs, we will repeat the names if you want. Let me repeat the names of the drugs. So you can give morphine, diamorphine for pain control, levomipramazine for controlling nausea, haloperidol to treat delirium, diazepam or midazolam to treat distress, hyoscine hydrobromide to reduce respiratory secretions. So this is what they are saying. Okay, some drugs that you will give to manage symptomatic relief. Okay, then which is a very nice thing that if you can give them a less pain death. Okay, less painful death. Support for the family. Make sure that you have contact details of the family. You should know who the person is. Okay, who has to be contacted and what facilities are available for them. You should make them aware. See, this is something that doctors themselves do not know who are working where, what happens next. Okay, that they should know. Religious and spiritual needs of this patient. Okay, sometimes they need the body to be wrapped in a particular position. Okay, so that you should know. Sometimes they do that. Okay, if you ask them to wrap the body in a specific position, they will do that because some people bury, some people burn, etc. Okay, then any particular wishes are there if you can follow. Then ongoing assessment, families awareness of the condition, so you will keep updating on that. Management of symptoms, we already told you. Parenteral hydration if it is required. Then care after death. Now here comes this after death, what you will do, right? Make sure the family knows what they have to do. Okay, then notify other health professionals. Notify other appropriate health professionals. Okay, who other appropriate health professionals will be? So basically, in our hospital setup, guys, only a witnessed death will be given a death certificate. So other people will have to go through other channels. Okay, so you should always be aware of these processes, procedures. You know, it will help somebody. Otherwise, we are always just blinking. We don't know exactly what to do. So you should know. Okay. So that is all that we wanted to tell you, how to manage a patient who is dying, and how we in the next video we will look at how to declare a person dead. What are the criteria? You know, and after death happens, another important thing to talk about is organ donation. We can save so many lives with the organs, right? So it has to be sensitively be handled by somebody who's trained in all that.